In the next few short clips, I'm going to be reviewing some EEG patterns that you will be encountering when you start using Ceribell. I encourage you to complete the training module and familiarize yourself with all the features of the portal. Here you see the scale ranging from plus to minus 25 microvolt, meaning between the two horizontal lines it is from plus to minus 25. So the entire space is 50 microvolt. For those of you not familiar with EEG reading, anything below 20 microvolt is considered to be low amplitude. Anything below 10 microvolt is considered to be suppressed, and anything above 200 microvolt is considered to be very high amplitude. And as you will see over here on the top right, this basically shows us the scale with which we are reviewing the EEG. So in the next slides, please pay attention to this scale. It's going to be for the most part 50 and sometimes 25 microvolt. In the next few slides, please pay attention to the scale. You will see that it's for the most part 50 microvolt, but sometimes 25. And as you change the scale, you will see that the waveforms become flatter. The first pattern I like to review is the eye blink artifact that you will see in frontal leads. Here you see the blink artifact. This is not epileptic discharge and clearly indicates that the patient is blinking his or her eyes. Here you see the eye blink artifact in more repetitive manner. This is the eye flutter artifact. The rest of the EEG is normal. Muscle activity or myogenic activity is darkening of the visual tracing. Because muscle or myogenic activity has about 1,000 times more power than the brain activity, it's going to darken the entire EEG. This type of activity has over 20 Hz frequency. If you change the low pass filter from 70 Hz to 30 Hz, you will make the myogenic artifact slightly lighter. And that is because you're filtering some activity above 30 Hz, filtering it out. If you go to 15 Hz low pass, it means you're not allowing anything above 15 Hz to pass. Waveforms almost look like brain activity, but very sharply contoured. This is not epileptic activity. It is byproduct of filtering it in a narrow range of 1 to 15 Hz. This can also be seen in conventional EEG very frequently. Movement artifact is seen when either the electrode is moving or the head moving and the electrode is touching an external object. And one way of confirming it is by changing the scale to either 100 or 250 or even 500. Here it means that the signal has more power than 1,000 microvolt. This is definitely neither muscle nor brain activity. It is just an artifact that is produced by physical movement of the electrode. EKG artifact is seen on the EEG. Usually these are seen across several channels and they are very regular and they follow the patient's pulse rhythm. One specific artifact that you will encounter on your Ceribell EEGs is the impedance check artifact. Every 60 seconds, the device is checking the impedance of its electrodes. Here you see a darkening of the EEG. It starts from electrode number 1 and ends with electrode number 10. Pay attention to this artifact happening every 60 seconds.